Dr. Varis, and welcome to Healthcare with Dr. Varis. Today, topic I have chosen for you is hepatitis, its prevention and its cure, treatment. One of the most biggest problem to nowadays we are facing with our daily life, and then we will see the most of the patients they are have hepatitis. Hepatitis is basically most viral. These are virals means A, B, C, D, and E and G. Among these, the B, C, or D, these are chronic hepatitis, and then viral and viruses which causes these hepatitis are in RNA virus and most DNA viruses. Here I will tell you about their sign and symptoms and how one can assess that I have hepatitis. I must feel loss of appetite, constipation, numbness in their limbs, and losing his weight and some time itching in his body. So one can feel that I have. It's most of the work of your routine practice doctor, which you are usually you attend you whenever you come as OPD patient. He will diagnose you and prescribe some tests, basic test, HbSG antigen and HCV antibodies. Then you will see that what I have acquired in my blood, that, and then we will proceed for the diagnosis, confirmed diagnosis on ELISA tests, PCRs and ultrasounds. When we achieve that, this is then we will use antiviral therapies, which are mostly in our institutions and our private sector as well. We have these antiviral therapies, most of the treatment of this. And I here suggest some ways of spread of that hepatitis is through blood transfusions, unscreened blood transfusions. Syringes, same disposable syringes which you will if you correct. Some of the quacks are using that practice, and by sexual contamination from where which client is have had an hepatitis previously, we will contact that, it will be spread. And most of the babies which born to the mother who had hepatitis, you can acquire baby must hepatitis. So we here sometime tell you that this is the foremost right of our body, its own right, that you must know about the I have hepatitis B or C, or what is my blood pressure, what is my sugar level and cholesterol level. These 5 points must know about everybody. Then these are insidious and the hidden diseases, whenever they appear, it will reflect with huge problems with you. Then it means you see viewers that when one person is as fit, as much as fit, when then if one will not talk you about the blood donation for your blood, and you will be ready for to donate, and whenever you will be tested, at then this hepatitis B or C will be appear, and at the time of screening. It means you first of all have had no any sign and symptom regarding that I am the patient, or I am the patient of that hepatitis B or C. But it was screened and it appeared on the tests that you have had that. So it is all about my hepatitis section. And if you viewers, if you have not subscribed until yet my channel, please subscribe that, as and onward I will tell you about more about that disease, and inshallah I will take care of it next for the next inshallah. This video is also present in Urdu, and inshallah I will present with new videos very soon inshallah.